Mothers are the foundation of Mexican families. They are the strength and hope of our nation. In Mexico, every 60 seconds, a mother gives birth to a child. But every year in Mexico, over 1,000 women die due to complications during pregnancy and childbirth. On top of this, over 20,000 women suffer from ongoing obstetrical problems for the rest of their lives. When a mother dies, families are destroyed. Partners are left to raise children alone. Children are left orphans. Parts of our communities are lost. This hurts not only our families, but our economy and the fabric of our nation. The worst part is that 80% of these deaths are preventable. In the year 2000, as part of the United Nations Millennium Development Goals, Mexico pledged with 189 other nations to reduce maternal mortality rates by 75% by 2015. Although the rates in Mexico have decreased, they have not lowered fast enough to reach the goal. And so, the government continues seeking solutions. The big question is, how do we save our mothers in Mexico? Global health groups, including the World Health Organization, the United Nations, the Pan American Health Organization, and UNICEF, have done the research, and they have the key. The United Nations Population Fund reports that in all countries that have achieved dramatic improvements in maternal mortality, professionally trained midwives have been the key to success. Babatunde Osotimehin, the executive director of the UNFPA, says, "The good news is that we know exactly what to do to prevent maternal mortality. First, we need to improve access to voluntary family planning. Second, we need to ensure that pregnant women have access to emergency obstetrical care. And finally, we need to invest in health workers with midwifery skills." Contrary to popular belief, professional midwives are trained in an academic setting. They are required to attend long-term practicum under supervision. They become experts in low-risk pregnancy, childbirth, and the postpartum period. And they are competent in recognizing, stabilizing, and when needed, referring serious emergencies. Study after study shows that for low-risk pregnancy, professional midwives are competent providers. Chile, for example, has made great advances in lowering their maternal mortality rates by incorporating midwifery. Their government has supported educational programs for midwifery for decades, and midwives are seen as an integral part of the healthcare system. Like Chile, in other countries with low maternal mortality rates, like Great Britain, Sweden, and Japan, midwives are integral parts of the reproductive health system. The results are in, and they are clear. Both globally and in Mexico, professional midwives are the key. Therefore, we call upon the Mexican government and decision-makers, as well as the medical community, mothers, and families, to promote the inclusion of professional midwives into the healthcare system in Mexico. If you are part of any of these groups, we call upon you to help us do the following. Number one, integrate professional midwives into the saturated Mexican healthcare system. Professional midwives are underutilized by the overcrowded healthcare system in Mexico. They are skilled, and their quality has been proven around the globe. It is time to integrate them into the healthcare system. Number two, help push for more schools. Midwifery was taught in universities in Mexico up until 1932, but these programs were closed. Currently, there are only 2 schools recognized by the Secretary of Health and Education offering technical degrees. The Mexican government must recognize already existing schools, clear pathways for midwives to open more schools taught by midwifery professors, and support a new college of midwifery. Number 3, support the new Association of Professional Midwives. In 2012, the Mexican Association of Midwifery formed in order to work together with government health and education officials to implement systems of self-regulation of midwifery and create real and efficient pathways for certification. Unite with this representative organization. Number 4, promote collaboration. An integrated working system of healthcare personnel is essential in order to save women's lives. Each person in his or her specialty should be respected, and all healthcare providers should work as a team in order to deliver the best possible care to the people who come to us for help. It's time for change. With your help and with midwives, we can make the difference.